So when it comes to exercise prescription, I follow myself, and then I also educate other clinicians to follow what I call my 3 golden rules of loading. And so what the 3 golden rules of loading are is, firstly, we want to load as much as we can as soon as we can, but there are some nuances to this. So what I mean by loading as much as we can as soon as we can, that is, we don't need to rest and immobilize someone completely in some situations. So one way that clinicians need to apply this rule is to always respect tissue healing time frames. So if you have an acute injury, our body needs to go through its healing process. So in the case of a fracture, oftentimes that will be 6 to 8 weeks, or some other fractures can be up to 12 weeks. But we need to allow the sufficient time for the body to do its healing process, and then we want to introduce load as soon as we can. And another example of this is if we're talking about, say, a lateral ankle sprain. So with a grade 1 lateral ankle sprain, oftentimes you only need to rest the area for the initial 72-hour inflammatory phase. Once that phase has passed and our tissues are starting to remodel, that's when we want to introduce load. And where a lot of clinicians they don't give their patients the proper service is they're scared to load these tissues. So they'll tell them to rest for 2 weeks, 3 weeks, 4 weeks. And over time, this makes the tissue weaker, and we miss that initial cell signaling that we need in the really early stages of healing. So loading as much as we can as soon as we can, whilst respecting tissue healing timeframes, is very important. And this goes across the board for any musculoskeletal pathology. So clinicians need to have an understanding of what happens in the presence of an acute injury or even a chronic injury, but also not resting too much. So another sort of nuance to the loading as much as we can as soon as we can is we only need to deload to the minimal effective dose. So what I mean by this is if someone only needs to modify their activity, that's a better approach as opposed to telling someone to stop doing that activity. Sometimes that's a better approach than resting completely, and sometimes that's better than immobilizing. But if you've got a fracture, you will need to immobilize or rest completely from a certain activity for a certain amount of time. So we don't want to overdose our advice to deload or rest an area. So following on from this comes to the second rule, which is we want to calm things down before we build things up. So what I mean by this is tissue reactivity trumps loading. So if you have an area that is really injured or really inflamed and it's going through an inflammatory phase, we need to calm that area down before we can start introducing load to build up that capacity. Now, for some people, this may be to calm things down, they may take some oral medication, so some anti-inflammatories or some paracetamol. That may be one way that they calm the area down. Another way that we can calm down the areas is by changing the way it's loading. So calming down may involve strapping an injured area, or it may be introducing an orthotic or footwear, because orthoses and footwear can decrease strain loads or even just other loads on connective tissues within the foot and the lower limb. So in the presence of some pathologies and injuries, the calming down phase may be days to weeks, but for someone else, the calming down phase may happen at the same time that we're introducing load. We may reduce one activity that they're doing, but then increase another. So there's a lot of nuance in this, but again, we don't want to load really reactive tissue. So if you have really badly sprained your ankle, you're not going to do star jumps on the second day after your injury, because you need to allow the inflammation to settle down before you start increasing the exercise and the loading that you're doing to the tissue. Now, these rules are, especially in the reactivity and the loading, so calming down and then building up, that's more looking at things if we're dealing with an acute injury or a really reactive chronic injury. But then the third rule of loading, and this is one element that a lot of clinicians that I deal with right across the world, they really struggle with this understanding, is pain does not always equal tissue damage in the case of chronic pathologies. So pain science is ever emerging and it's evolving every day. There's so much research that's coming out very constantly on this topic. But one thing that people, the general public, but even a lot of clinicians think, they think all pain is bad. Pain is a protective mechanism, but sometimes, especially in the cases of chronic pathologies, pain can be there without any tissue damage. So pain is an output of the brain and it's very complex. So one thing clinicians need to understand is we don't have pain receptors. How pain is generated is our body will feel sensations, our nerve receptors will pick this up. This information comes up to our brain and then our brain interprets this information. And then if the brain thinks or feels that we're going to have tissue damage or it's worried that tissue damage will occur, it will output pain to make us change or stop doing something. So what can happen in chronic pathologies is that system can not function how it's meant to. So pain can be coming out of the brain without any tissue damage being present. So sometimes our treatment interventions need to focus on communicating with patients, educating patients that they can move, and this is where I'll tell people and tell clinicians that I'm educating that in the presence of chronic pathologies, we need to give people permission to move. So if people are coming in and they have chronic pain and there's no actual tissue damage present, we can load it. And if we educate people that they can move and the pain that they're experiencing isn't necessarily a result of an injury, and they can help work through that and overcome that, that's how we can help people overcome their chronic pain presentations. So again, my 3 golden rules of loading is we want to load as much as we can as soon as we can, then calm things down, build things up, which is tissue reactivity trumps loading. So both of these are really respecting the tissue healing timeframes. And then the third one again is pain does not always equal tissue damage in the case of chronic pathologies. So if clinicians are able to have an understanding of these 3 key elements, then it gives clinicians, I feel, and in my experience, a lot more confidence to introduce exercise and movement-based therapies to help people overcome pain and achieve functional restoration.